Good morning and good afternoon, ladies and gentlemen. Thank you for joining us for today's webinar, The Importance of HIPAA Compliance for All Modes of Clinical Communication, brought to you by PerfectServe. Before we kick things off, I would like to take a moment and cover a few housekeeping items. This webinar is being recorded, and all phone lines are currently in the listen-only mode. You can submit questions or comments throughout today's presentation using the Q&A box located on the right of your WebEx dashboard. With us on the line today, we have Leanne Myers, Chief Clinical Officer of PerfectServe, who will serve as today's moderator, as well as Terry Edwards, the founder and CEO of PerfectServe. Leanne, at this time, it's my pleasure to turn the call over to you. Leanne?
Good afternoon. Wendy, thanks for the run-through on the housekeeping items. As Wendy mentioned, I'm Leanne Myers, and it's my pleasure to serve as your moderator today. We know your time is valuable, so thank you for joining us. Here is a look at today's agenda. Terry will start us off and spend just a few minutes introducing you to PerfectServe, and then we will jump into what's going on in the industry right now. He will then walk us through a four-step approach on how to get started on securing all modes of clinical communications. And finally, we have some really interesting data to share from an in-depth case study that I think you will find helpful in managing HIPAA compliance. We will hold questions until the end, so be sure and submit any questions via the Q&A feature, as Wendy mentioned. We are committed to wrapping up today at 2 p.m. or maybe a little before to help keep your day on schedule. So at this time, I'm going to turn things over to Terry Edwards. Terry?
Thank you, Leanne. As Leanne mentioned, I'm going to give you a short overview of PerfectServe, really to provide some context for our discussion today. And I'm going to start just by answering the question of who is PerfectServe. So, and then we'll get into what we do. But PerfectServe essentially is an intelligent clinical communications platform that connects clinicians in any care setting across the continuum. Healthcare providers partner with us to help improve outcomes and operational efficiency because we enable them to remove communications process variability and speed contact cycle times between clinicians, which helps them better coordinate care. And to illustrate what we do, I'm going to share a process flow from one of our clients that really demonstrates the problem that we're solving. And we'll refer back to this throughout the presentation today because the challenge not only has to do with improving process, but securing it as well. So this is the nurse-to-physician communication process flow for one of our client hospitals, Memorial Care's Orange Coast Memorial Medical Center in Orange County, California. And this was the process as it was mapped out before PerfectServe was deployed. And I know you can't read it, but that's not the point. What you see is a process with many actors and many steps, decision points, a lot of variability in the contact modes as well as communication handoffs. And in this particular hospital, the staff was running through this process probably some 600 to 700 times each and every day. By contrast, this is what the process looks like today. And as you can see, we've eliminated a number of steps, the decision points, the handoffs, as well as the actors. And you would think this would have an impact on cycle time. So in addition to mapping the process out, we actually measured cycle time. And this chart shows what the pre-implementation cycle time was before PerfectServe was deployed. Each of the orange bars represents a communication event, and you can see that the average of the events that were recorded during this period was nearly 46 minutes with a 10-minute median. But the big concern, too, is the fat tail out over on the right-hand side where we start to approach 30 and 40 and 200-plus minutes, which is where there's a significant risk. By contrast, this is where the process is today. And you can see that we've been able to help them take the average down from about 46 to 15 and the median down from about 10 to about 6, 40% reduction. while reducing the fat tail on the end. So in order to help our clients, there's really 4 capabilities that PerfectServe brings to the table to help deliver these kind of results. The first being our communications platform and rules engine that was really purpose-built to address the complexity that's inherent in real-world clinical communication processes. The second is a best-in-class services organization to quickly drive communications process improvement and standardization across an organization and then help it sustain those improvements over time. Third, a single cloud-based architecture with interfaces and applications that are all integrated to connect interdependent clinicians wherever they may be providing care, both inside as well as outside the 4 walls of the hospital. And then finally, a secure infrastructure, which is really required to manage HIPAA compliance risk, which really leads us into today's topic, HIPAA compliance. 4 steps toward HIPAA compliance, and there's no such thing as a HIPAA compliant app. As we explore this topic today, the first thing I want to tell you is that I'm not an attorney. And this webinar is really educational in nature and not to be taken as legal advice. We've conducted a lot of research, worked with our own attorneys and our clients extensively over the past year, and I want you to know that we take this topic very seriously, and I take it seriously as PerfectServe CEO because we are processing tens of millions of electronic communication transactions every year, most of which contain electronic protected health information, or ePHI. And while we're processing these transactions on behalf of our clients, which includes some of the most prestigious health systems in the country, PerfectServe as a business associate, we share the same level of risk as our clients. And so it's for that reason that we take the topic very seriously. So let's start with what's going on in the industry. Since 2003, the Office for Civil Rights, or the OCR, has received more than 85,000 complaints of HIPAA violations, and more than 2/3 of those investigated required corrective action. In 2012, 115 organizations were audited, and 68% of them had adverse findings. And since 2003, HHS, or Health and Human Services, reported that 720 organizations and 167 business associates have contributed to the disclosure of more than 27 million Americans. So without a doubt, this is a tremendous industry challenge that has been made more challenging by the change in regulations that occurred in the fall of 2013. Those regulations are somewhat murky. They're not as clear as we would like, and there have been a number of vendors who've come into the market suggesting one-size-fits-all point solutions. And all of this combined, we have observed, has really resulted in a lot of communication among clinicians and leaders in healthcare delivery organizations. So we're seeing compliance failures more readily now as increased enforcement has become more impactful. And here you can see a couple of recent examples. And the HIPAA security rule is technology neutral. Nowhere, if you study it, nowhere will you find that it prescribes the use of or the avoidance of any specific mode of communication. What the law says that you need to do to achieve HIPAA compliance is really 4 things. And those 4 things include performing a formal risk analysis, developing a strategy to manage that risk, implementing your strategy, and then monitoring your risk on an ongoing basis. So let's unpack each of these a little bit further. So in terms of performing your risk analysis, you really need to start by understanding where ePHI lives in your organization. And it really starts by addressing questions about how ePHI is created and transmitted electronically across the enterprise and the types of technologies that are used. And when it comes to clinical communications, it's really that information can be all over the place. Remember that spaghetti diagram that I showed you earlier of Orange Coast before PerfectServe was deployed? What you find as you begin to peel the onion back is that the ePHI is being created and transmitted via a host of means such as websites, switchboards, third-party answering services and call centers, and SMS texting, paging, messaging apps, voicemail systems, and so on and so forth. So your assessment really needs to consider some questions about how ePHI is created and transmitted across the organization. And so some of the questions we've listed here that you might want to consider have to do with things such as where, physically where is it being created? Is it being created, for example, from websites? Is it being created from the phone and then transmitted via other means? Are text messages being generated from carrier websites, and is the contact modality of the recipient known? Is ePHI being handed off to third parties, which then transmit in ways that are outside of your organization's control? And then are hospital switchboards in the process using console-based software, for example, sending messages to doctors and other clinicians? And is that data stored on secure servers, encrypted, and then delivered via secure means? A few other questions to consider might be, how are staff receiving the communications? As we've mentioned already, there's pagers, there's mobile phones, which could be receiving messages via SMS text or voicemail, smartphones, tablets, computers, and then standalone messaging apps. Are the devices provided by the organization or owned by individual staff members? And is the ePHI stored on devices or on secure servers? And then audit logs. Are there audit logs of the communications available? As you ask these questions, your assessment really needs to consider the strength of really three things: the administrative, the physical, and the technical safeguards as well. And the administrative would be your policies and procedures. The physical would be the physical location of devices and their protection. And then the technical would be things such as passwords. So step number 2 is once you've completed your assessment, it's really developing your risk management strategy. And this is about the processes, tools, the policies, and procedures that you're going to put in place. And this is all about managing the risk of a breach to a reasonable level that is specific to the needs and vulnerabilities of your organization, as I mentioned, as determined in your risk analysis. So some questions that you might want to consider there would be, what processes and tools will you put in place to ensure, to best ensure the transmission and receipt of ePHI, and from all the different sources to all the different channels that you observed as you went through the analysis. You'll have to make decisions about, will it be acceptable to employ communication processes in which staff can receive ePHI on unsecured devices when you determine that they may be more reliable than secure devices based on patient safety issues. And as you consider that, you'll have to take into account just how much PHI is needed, and the law really points towards the minimum necessary to minimize the chance of a breach. And then you have to think, too, about what access controls you'll establish and put in place. As you further consider your strategy, as you bring in different organizations and partners, you want to make sure that you choose those that are mitigating the risk associated with the communications that are really originating from a variety of disparate channels. You'll need to make decisions about permitting staff to create text messages via mobile carrier websites, and deploying processes that reduce or eliminate handoffs to unsecured third parties. And you should also consider solutions that can enable fail-safe backups if you're relying on smartphone devices, for example, that are dependent on the data networks, because the reliability in some situations may be less than what you might find with typical paging technology. So as you answer some of these questions, you want to answer them in ways also that would take the form of the statements that we've really outlined here. So are your communication processes and system designs done so in a way that they're securing the flow from all the channels that you've identified in your assessment? You're going to want to put in place written detailed policies about following the new processes and include the consequences for the violations. And then you'll have to establish protocols as well regarding what actions the organization will take in the case of a suspected breach, and that can include just the communication inside your organization as well as contacting oversight agencies, patients, and even the media if it's a very bad situation. And then you need to make sure that you have established processes for creating the audit trail of the communication transactions, and that would include sender, receiver, message date, and timestamp in order to provide the information for reporting in case of a breach. The third step in your strategy then is to implement your program. So you've done your assessment, you've developed your strategy, you need to implement it, and as you do that, you want to consider assigning the specific tasks to appropriate individuals that you can hold accountable. Some key points here that you'll want to think through, if you've brought in a technology partner, you want to ensure that it's working with your clinicians to design new processes that will support your strategy as well as will be adopted by them. Leaders, and if you've established a HIPAA compliance committee, the members of that committee must consider monitoring the success of your implementation and really provide direction and guidance when process changes are challenged. And in healthcare, we know that that can be tough in dealing with physicians at times. And then staff members need to be educated about your new processes and policies and the procedures that you've developed. And then as you bring in new employees and associates into your organization, you really need to consider the training being part of the entire new hire orientation process, and then that training needs to continue on a regular basis. So the last step in your process is to monitor and measure your risk on an ongoing basis. And here the idea is really to ensure continued compliance and adherence to your strategy, and then reassessment of your risk on a periodic basis. This will guide your technology, really updating guide updates in your strategy over time as the technologies and new models of care delivery evolve. And some questions here to consider would be of all the PHI, ePHI that's generated in the organization and transmitted, which are in compliance with your policies and which are not, and therefore creating risk. Are clinicians continuing to follow best practice contact modalities, and are they aligned with the then current HIPAA compliance policies that you've established? As new devices become available, does your policy about minimally necessary information need to change? And then are your administrative safeguards sufficient? You know, your passwords, PINs, or perhaps policies related to deleting texts after deleting them or after reading them, are they being followed? So, so those are the 4 steps to achieving HIPAA compliance. And as we move to the next section here, we want to share with you 2 hospital case study. These are 2 hospitals that are about the same size, about 360 beds, and about the same amount of admissions. I believe it's about 19,000 annually, and similar medical staffs. And Hospital A, in this case, had conducted a comprehensive analysis. It mapped out all of its processes regarding where, who, and how ePHI was being created and transmitted. And as they went through that process, they determined that what was required was really technology as well as process oriented to ensure adoption. And the analysis suggested that they needed to encompass secure messaging, but also accommodate paging, SMS text messaging, real-time calls, and voice messaging. And then in addition to these modalities, they needed to provide workflow process rules, and this would have to do with if-then types of rules related to physician coverage and availability to ensure adoption. They selected their tools, established policies and standards, and then implemented, and now they're monitoring on an ongoing basis. I want to just share with you a couple of charts from this organization. And what you can see here is just overall utilization of this, this secure communications solution. And the organization is running around 16,000 transactions a month. And the other thing that's interesting is in this chart, in the data set, the blue part of the bar are the hospital-to-physician initiated transactions, and then the red are the physician-to-physician. Most of the hospital-initiated are driven by nurses and other clinical staff, which is quite interesting in comparison to the physician-to-physician piece. The second graph illustrates the breakdown of various modalities. And we can see here that about 60% of the transactions are occurring via secure text messaging. Secure voice calls would be next, numeric paging, and then this fourth area is transferring communications off of the system into mobile phones directly, then secure voice messaging and text paging. What's happened in this particular case is, with the exception of the transfers to mobile phones and the handoffs, the PHI is controlled in all other communications. And the organization can monitor this as time goes on for adherence to its policies. The second hospital, Hospital B, did not conduct a comprehensive analysis as did A. It really determined that it only needed a secure messaging solution, and its priority was on securing physician-to-physician communications, with its second priority on securing nurse-to-physician communication. Because nurses did not have mobile devices, they would use the web to communicate with doctors. They selected their tools, established policies, and then implemented. The difference between these two organizations is the policy did not establish any new process standard. There was no rule that said this will be the way that you will communicate moving forward. So the tool was put in to the organization with the other fragmented processes that exist today. And we can then look here and see the utilization of the solution in this organization, and as you can see, it is a fraction of the other hospital, not even approaching 1,000 transactions a month on a monthly basis over the same time period. So they were unsuccessful at really driving adoption in this particular organization. So some conclusions, really three high-level points of this study. The hospital that deployed the comprehensive solution realized dramatically higher utilization and adoption than the one that deployed a secure text messaging solution alone. Securing the physician-to-physician text messaging by itself does not mitigate HIPAA-compliant risk. The greater risk is in the high volume of hospital-to-physician communications, which are primarily initiated by nursing. And then standardizing the process with a comprehensive solution that secures all communication and improves workflow is what is really required to achieve high clinician adoption. And one of the things that we observed is, as you consider securing just using tools such as secure messaging versus a more comprehensive approach, the layer of security that's required in secure messaging requires extra step or extra work for clinicians, especially doctors, and time being the most valuable asset they have, the solution really needs to bring greater benefit than security alone. So we'll pause there, and I'll turn it back over to Leanne to open it up for some question and answer.
Thank you very much, Terry. Just as a reminder, we've had several questions come in, but you can submit your questions in the Q&A box over on the right. We will get through as many as we can, but still ensuring that we stop on time. If we don't get to any questions, we will definitely follow up with you and make sure that we get those answered. So Terry, the first question is, you mentioned something about there's no such thing as a HIPAA compliant app. What do you really mean by that?
Well, it's really, it goes back to the 4 steps. And in that, HIPAA compliance is really about following those 4 steps. It's conducting your risk analysis, documenting what you found in that analysis, then establishing your risk management strategy, which is how am I going to mitigate and manage to this risk, implementing that, and documenting that you've done that. And then, of course, the implementation is the 3rd step, and then the 4th step is just monitoring your adherence to the policies on an ongoing basis. It's really all of that, all of those 4 steps being followed within your organization, along with the appropriate documentation that would determine whether you're HIPAA compliant or not.
Great, thank you, Terry. Next question is, how do you share the same risk as your clients?
Well, we're sharing in the risk in that we're an extension of the client organization. I mean, one of the big changes to the law that occurred in 2013 is there was really teeth put in the law to hold business associates accountable at the same level as covered entities for the protection of ePHI. And so to that end, to the extent that there's a breach within PerfectServe, or even one of our clients have a breach, we are likely to be investigated as well.
Great, thank you. How are you advising your customers to handle the idea of bring your own device policies?
Well, all of our clients are in a BYOD environment. We're beginning to see smartphone adoption by nursing more. It's not, with the exception of a few organizations, where we have seen that adoption, it's been with hospital supplied devices that may need to be hardened and ruggedized for that environment. But we see, I mean, physicians have been really the vanguard of bringing BYOD into the healthcare enterprise, and they're at the front of our user base.
Great, thank you. The next question says, in addition to the right technology, what are the right things we should be doing from an administrative perspective? And I think this really relates to, once you select the right technology, what should you be doing from an administrative perspective?
Well, you have to make sure, you need to go back and make sure, are the technologies that we're selecting going to help us address the vulnerabilities that we determined in our risk assessment. And as we've learned with many of our clients, it's typically more than just the technology that you have to put forth. It's really, you've got to have tools that are going to address the process as well. Because the problem today in most organizations is that the communication tools and the communication processes are extremely fragmented. And in order to get your arms around the fragmentation, to really even understand what your risk is and to measure it, you really need to pull it together. And pulling it together, bringing it together on a common platform is step number one. Once you can then start to measure and look at what communication is going to whom and what are the contact modalities that are being used, then you can continue to assess your risk and improve this over time. It's not just a do it once and done. It's a continuous effort of improving both the security of the communications as well as the processes overall.
Great, thank you. The next question is, do you know how long we have to save all of our clinical communications? Does PerfectServe archive communications that travel through their platform? If so, for how long?
We archive everything, and it's available online for about a 2-year time period, after which it's backed up and we archive for 18 years.
Great, thank you. Next question is, healthcare organizations have suffered from a lot of healthcare information theft and loss. It seems like we hear about it every day in the news. What are the core challenges that healthcare organizations must address to help turn this tide?
Well, I think that a lot of that has to do with just following best practices within the industry as it relates to the devices, and you're talking about theft and loss here. You're really talking about devices, so that can fall into the area of servers and hard drives and laptops and things like that. Laptops are carried around. They might have medical records on them and things like that. There are certain safeguards and precautions as it relates to data encryption and password protection to ensure those devices are secured. There are certain policies related to best practices regarding the disposal of hard drives within an organization. For example, when in our organization, as we decommission hard drives off of our servers, they go to a physical place where they're destroyed, and one of our people, one of our network engineers, actually follows and watches that those drives have been destroyed, and we document that. And then there's similar things as it relates to mobile devices as well, and as it relates to encryption and encryption of data that might be on those devices, as well as just their overall management using perhaps a mobile device management solution.
Thanks, Terry. Next question is, can you expand on the functionality of the date timestamp? This may help us with some of the tracking challenges that we are facing in our organization.
Well, as you look at trying to improve or secure anything related to a communication transaction, when there's a breakdown in the process, whether it be a security violation or just a communication breakdown itself that creates some other problem, whether it's a satisfaction issue or a patient safety issue, you need to know, all right, where did this communication start, from whom, what device, what phone number, what website, for example, who was logged in, when did this occur, and then to whom did it go. And so the more data you have on that, the greater your likelihood of being able to improve it. Now, within our organization and for our clients, every transaction that occurs is documented. We know the date, the time, we know the facility that it originated from, we know the department that it originated from. If it's a patient call into a doctor's office, we know the time, we know the calling ID number, we know to which clinician that it went. If a secure message was left, we know what time it was played. If it was not played or read, we know what the escalation steps were, and so on and so forth. And by following that trail, you can figure out what happened. And then once you know what happened, you can address it and you can improve it. And as I said, that goes not only for improving things from a quality safety standpoint, but from a security perspective as well. So if, for example, we know that we are sending messages to alphanumeric pagers because they're more reliable, what's the data that we're sending? Are we controlling? Are we removing ePHI in that particular case?
Thanks, Terry. The next question is, How do you assess where all of your clinical communications are coming from and going to? It seems like a daunting task.
It is, and it can start just by going through your organization on a department by department basis, and it can start by observing and asking and documenting what the current processes are. So in my years in the industry, I don't go out early as much as I did, but it is amazing to see the myriad ways that clinicians in the acute care environment go about connecting with each other and with physicians. You'll find nurses going to web pages in one department because there's a group of doctors who want to be reached a certain way, and there'll be phone calls made to the switchboard. There'll be phone calls made to third-party services, multiple ones in many cases. There's device-to-device texting going on. It's very fragmented, very, very fragmented.
Thanks. Next question is, when listing your assets and where PHI lives, do we need to list others with whom we are interfaced? And does this fall under ePHI, which is transmitted?
That's a good question, and it is really one that you should talk to your attorneys about. We look at that from the perspective of the string of a transaction, and if it's my PHI, for example, or the PHI of one of our clients, and it is going outside the organization, it might start as a voice call, for example, and that results in talking to a operator in a call center who's then transcribing a message. Well, now that message has been transcribed. It's now on the servers of that third party, but it's my data. It's my PHI. For example. So we have always taken the approach that it's your data to begin with, and you need to be thinking about the entire process. I mean, just think about a doctor who is in a 6-physician primary care practice. It would not be unusual for that physician to receive 100 messages on a Saturday when he's covering call for the physicians in that practice. And it wouldn't be unusual for all those messages in that one day to end up on one paging device, and he loses that device, and that's all your PHI. And that PHI went to a third party before it got to that device. And so again, we take the approach of really securing the entire communications event from end to end.
The next question is, do you think a reassessment of our strategy should occur once a year or more often?
That, I think, depends on your organization, and again, that too might be a legal question. Within our organization, there is a continuous effort around privacy and making sure our policies are being followed. And as that continuous effort is going on, we might find something, for example. We then take action on it, and we make sure that it doesn't happen again. So it is really an ongoing effort.
Great, thank you. The next question is, does the same HIPAA security strategy apply to large and small practices as well as hospitals, or do they differ?
This is where it gets a little murky. In that, and going back to that assessment, it's really the assessment is trying to assess the risks and vulnerabilities of a breach to a reasonable level for your organization. Well, what is reasonable? And again, that's where it comes back to getting advice from your attorney on what's reasonable for your organization. But it is certainly a heavier burden for a smaller organization than it is a large one.
Great, thank you. The next question is, we struggle with the measurement aspect of our strategy. What do you think some of the key things are that we should be measuring?
Well, I think most organizations are struggling if they have no way to monitor. And you know, it comes back to the organization being, the communication processes in most organizations being extremely fragmented. The more fragmented they are, the harder it is to monitor. And you know, if I refer back again to that spaghetti diagram at Orange Coast before PerfectServe was deployed, I don't know how they could have measured and monitored things beforehand, because it was all manual. And there are numerous third parties involved, and what was done by one nurse in one department who works, you know, third shift is different than another nurse in the same department working first shift, because the one on first shift just has more knowledge about the medical staff, for example.
Great, thank you. One more question here is, do most of your customers, or the customers that you go out and visit, have a physician on the IT security committee? In our hospital, there seems to be a divide between what IT is doing and maybe what's the best clinical decision.
We see that in a lot of organizations, and you know, and those that are best will try and bridge that divide by having you know, key influential physicians on certain committees and to affect policy. So it's I mean, it's been our experience that whenever you can involve clinicians in the design and the development of the solution, you're going to end up with something that's better, because they're the ones whose workflow you're impacting.
Great, thank you. And that was actually our last question for today. One, I want to thank all of you for your fantastic questions and spending some time with us this afternoon. To me, what became very clear is that HIPAA compliance is and continues to be an ongoing challenge in our industry. It's probably not going to be lightening up. Before we wrap up today, I wanted to share with you some additional resources that are available. There's a more detailed white paper that Terry discussed today about the 4-step plan, and then a paper that we wrote with our attorney about clarifying the confusion about HIPAA compliant text messaging. There's some other resources available as well. Also, all of our previously conducted webinars can be found on the PerfectServe website in the Knowledge Center. In addition, we've had several questions about, are there any additional resources that are available about the audits and the assessments? We will put some links to that type of information in our follow-up email. Yes, we did record today's call, and the slides will be shared. Be watching for those to come into your inbox. And we will also be sharing with you a copy of our newly released security brief with additional research and insights to HIPAA compliance. And that concludes for today. As always, if you have questions or comments on today's webinar, please feel free to reach out to us. And again, thank you for joining us today on this important topic. We know your schedules are busy, so we appreciate you finding the time to be with us. Have a great day. Thank you.
Thank you for joining us, everyone. This will formally conclude today's webinar. You may now disconnect your phone lines and exit the webinar. Thank you.